I'm Nick Vogelzang. I'm a medical oncologist specializing in chemotherapy, and I've been involved in treating mesothelioma patients for almost 30 years now. Well, we are currently conducting trials in the Southwest Oncology Group, adding a new drug to it, but that may be another 5 years or more before we can discover a better therapy. The French have added a drug to that combination, and hopefully the French will show us the way forward, although we have, again, quite a long time to wait because these studies do not go quickly. The combination of two drugs is always more toxic to patients than a one-drug regimen. When we studied Alimta by itself, it was quite well tolerated. In fact, Alimta by itself is still widely used in the treatment of lung cancer. Combining Alimta with platinum adds to the side effects. Platinum has far more side effects than Alimta. The side effects of platinum usually include things like fatigue, loss of appetite, weight loss, vomiting from time to time, nausea, and some constipation. The patients often feel nausea. We have very good nausea medicines now. They feel loss of appetite, and that's a challenge. We have drugs called megestrol acetate, which can stimulate appetite. I've had a few patients tell me that medical marijuana helps. I've had a few people who take a drug called Ritalin, which makes their energy level higher. The constipation, of course, and the diarrhea that comes with it, those are medicines available for those two side effects. You have to prevent the constipation. Sometimes people get mouth sores, and there's, again, modestly effective medicines, not great medicines, to prevent and treat those things. Well, I would always counsel a patient to know their statistical risks. There are certain groups of mesothelioma patients who should absolutely be treated with chemotherapy. There are other groups of patients who probably are too sick to be treated. That's a hard judgment to make, but we know that if a patient is bedridden more than 50% of the day, those patients should rarely get chemotherapy. But if those patients are healthy, they should take chemotherapy. Absolutely, surgery should always be considered, but if the tumor is growing through the chest, into the muscles or into the bones, causing severe pain, those patients often cannot be operated on successfully.